New videos every day. Life, wisdom, Psychetruth, massage.
We said in the previous video that the goals of myoskeletal alignment techniques are to level the sacral base and to level the head, the occiput, through the OA joint. This technique is something that I do every session to help level the sacral base. Most people who are right motor dominant, throw with the right hand, kick with the right hand, get this pelvic rotation that is we show it in all of our videos and books, where they're rotated like this. So we are going to try to take some of that torsion out with this Texas twister technique here. It's an iliosacral technique. It helps sacroiliac joint problems too, sometimes, not always, but it definitely helps level the sacral base. And so I always do this every session. I don't let them get out of the session unless they've got a nice level sacral base and their pelvis is neutral, which is a thing that Ida Rolf was always insistent on us doing too. So I'll do this first, and Paul's going to come in and do some other things for this low back. This is all aimed at low back, SI joint pain problems. That's what we're doing. So anyway, right here we've got slightly. She's pretty well balanced. She's got nice lumbar curve here, nice thoracic curve. Looks good, but we're going to use it for an example anyway. This PSIS over here is a little bit posterior. We want her whole pelvic bowl's moving around this vertical axis, so we're going to want to pull it back around. This is very simple. Use this technique all the time. I'm coming with my fingers pointed back toward me, palm right here on the PSIS on her left side. Coming over, and sometimes on bigger people, you want to come in like this so that you can pull this hip up. So get your lumbar lordosis, don't lean over them and round your back. Come in like that. Come in with a soft palm here on the ASIS here, on her right ASIS. Get my lumbar lordosis locked in so I'm not going to hurt my own back. Come in with this palm back on the PSIS, and now I adjust my weight again, my body weight again. So here I go. So now I feel pretty comfortable. See how I'm twisting her, Texas twister. I'm going to pull her to the first restrictive barrier, and I'm going to ask her to gently, with a 20% effort, pull this right hip toward the table. 2, 3, 4, 5, and relax. Give it a couple of seconds to reset the receptors and twist it a little bit more. One more time. 2, 3, 4, 5. Relax. Give it a couple of seconds and twist it. One other thing I like to do while I'm here is come on over on the lumbars and the lower thoracic spine here and just give it a little stretch. That sometimes feels pretty good. You like that? And you could actually pull that here. We start to lose space in here, particularly our elderly start to lose space here. Get some space in there.
Another thing too is just, with strain patterns, not only it's coming from the right shoulder too, so you're getting the diaphragm.
Right.
Which is a nice
Right, you're getting that whole cross pattern on the front, that anterior spring system we talk about in myoskeletal books and stuff like that. By the way, we're here at Paul Kelly Workshop, El Tropicano, here on the Riverwalk in San Antonio, and we just got through with our first day of Paul teaching and me assisting, which is the first time
ever.
Yeah, it's been a blast. I love being a teaching assistant. And we're really grateful to be able to shoot these videos here. Okay, so that's the first thing, and that's going to help level the sacral base. Then the next thing, Paul's going to come in and show you, talk about what you want to do.
All right, so we're going to kind of follow up with what Erik just did. He was talking about that right motor dominant pattern that we always see, so I'm going to follow up with that into the leg now, because it's going to affect not only the pelvic bowl as it rolls, but it's also going to affect the sacrum, because it's going to drag the sacrum with it. So it drags the sacral base with it, and it also flips up the ILA, or inferior lateral angle, down here on the lower part of the sacrum. So that's where I'm going to come in on. And we're going to use the leg as a tool. A lot of times the stance leg is going to be the tight leg. We know that she's right motor dominant, kicks right, stands on the left, so this is going to be the stance dominant leg. It's going to be a little bit tighter, especially in the hip, in the stabilizer. So what I like to do first is, if you can, try to put their foot, I like to get the forefoot because it gives me a little room to work. If you don't have a long arm and you can't reach under the knee, try to use the foot where you can drop it down and gives you a little more space to work with. And just slide your hand under the knee. Now there's different ways to do this. If I wanted to come off the sacrum first, I could, because this rolling thing that he just did with the Texas twister is flipping up this inferior lateral angle on that sacrum. So if I wanted to, I could start the technique just with my palm on the lateral angle of the sacrum, which I like to do first. So we'll start with that, and I'm pushing it where I want it to go. Remember, it's twisting this direction, and I want to pushing it out of that rotation. So I'm going to push it right here with my palm. As I do that, I can step back, look at my chest, and my posture is really good. And then I abduct the leg as I internally rotate it at the same time. So I'm hitting a lot of muscle groups here. Psoas, adductors, iliopsoas, also external rotators. So she can pull her knee to the midline for 2 seconds, 1001, 1002, and relax. And when she does, I can just increase that stretch and put a little more pressure at the sacrum. Embracing that sacrum, don't want it to move. Have her pull down one more time here, 2, 3, 4, and relax. When she does that, I'll just take that slack out, muscle spindle, and then I'll just come off that. How'd that feel?
Show them the hip capsule too.
And now I'm going to come into the hip capsule. So now we're talking about the hip capsule. Totally different. That's was sacral, iliosacral. Now we're into the hip capsules. If the hip capsules are stuck, you're not going to get any good results. So you always have to free up the mechanoreceptor response of the hip capsule. So go ahead and first, I just like to pump it sometimes just to see how much joint play it has. Put about 20 pounds of pressure, add another 10, spring it, see if it's got some spring. She's got a little spring. And then I'm just going to go ahead and just rock back into my left leg. Sometimes I stand just like a rocking type stance where I rock left to right. I like to do this. Monitor the low back, make sure you're not increasing too much lumbosacral angle. You don't want to do that and cram those joints together. If they're having low back pain when you're doing this, you need to have them brace with the core. So I have them breathe out real hard, pull the navel to the spine. Go ahead and try that with me. That's right. So I come back into this extension. She can brace the core. Are you feeling that in your low back? You are? Okay, she does feel it in the low back. They should not feel that in the low back. So if they're feeling that in the low back, those joints might be coming together and clipping each other. So tuck your tail. She could tuck her tail.
Yeah, you got to keep that hand pinned really tight.
You got to really pin here.
He's got that pinned real nice and tight there.
And you can also change your grip. If you don't like that grip, turn your palm this direction. Either way works really well. And then sometimes I like to come on the ischial tuberosity. If I come on the ischial tuberosity, I really like that grip because that pins that tail down.
And look at the direction. He's kind of going like this now.
Yep, and I'm following the direction of the ischial tuberosities. So
that's more quad.
That's more quad and iliopsoas, right?
You're stealing my next technique, dude.
Oh, I'm sorry. We're going to show another one too, so stand by. All right, here we go. So I'm done with this guy right here. All right, Eric, what are you going to do?
Okay, we're going to do a similar thing. I really love this technique. Were we going to do the side lying?
Yeah, side lying. Let's roll her on her side.
Okay, just lie on this side. All right, that's
good. Right there's good.
Okay, she's going to grab this bottom knee, top hand and bottom hand, under and up, and you've got to keep this thing way up there flexed. And why we've got that up there, of course, is to keep the pelvis from rolling. Again, we do not want to create too much flexion in the hip, which increases the lumbosacral angle. In other words, it crams the L5S1 joint together. We don't want to do that. I love this technique because it gets a bunch of things at one time. Mm-hmm. You got the foot here with my left hand, come over here on top with my right hand, and I bring it into extension. I can already tell that she needs this technique. Yeah. Look, she does not even want to quite come to 90. This would be at 180 degrees right here. She does not even want to come there when I'm pulling like that. So I know I'm going to want to stretch this. To stretch the proximal, I bring it back like this. So first, I'm just going to come to here. I'm going to put my leg like that. This is usually a one-handed technique if you want it to be a foot and a hand. Okay, now I'm going to ask her, in order to stretch this problem that she has, just to push against me right here with her leg. So just go forward, perfect. 20% effort, 2, 3, 4, 5. Once you relax, I'm going to stop. You have something to say there?
Well, I was saying right here, sometimes they're going to want to roll backwards.
So you're going to come in here like this.
With that left hand and brace that.
You're going to come in.
Mm-hmm. There you go.
And you're going to want to do that. Now, push again with your knee. Yep. 2, 3. You've got to really, this part you don't have to be that careful with. It's not that big a deal. But the next part you do. And relax. And then I bring her back just a little bit to barrier. Now, that's to stretch that. Now, if we want to stretch the knee, this is where they feel it. Mm-hmm. You're going to want to bring her into a little more knee flexion. So as I just take my body and bring her into a little more knee flexion, she's going to start feeling it more here. So I'm going to stretch a little bit of both. I'm going to bring her into hip flexion up here, hip extension here, and knee flexion here. Okay, so this time I just want you to push your foot against my body there. Just push your foot against me, perfect. 2, 3, 4, 5. When she relaxes, I'm going to hold right here, but I'm going to move her foot back closer to her buttocks, a little bit closer.
Be very careful with the knee on these.
Yes, you'd never do this with pathologic knees of any kind, or if there's any pain in the knee, if there's any clicking, popping, you don't do this. But it's just a really good stretch, and what I like about it is it's quick. You get the anterior hip capsule, you get extension in the quads, and you also get a lot of rectus femoris work. Okay, push against me with your foot, and also push with your knee again. Perfect, and relax. Very good. A big stretch here.
Wow.
So those are some of our low back techniques, and we actually taught those today in class. So hey guys, come out, check us out on the road. We're going to be teaching. I've got 8 more seminars this year. He's in Oklahoma City teaching, and Costa Rica. I'm going to be in Park Ridge, New Jersey in a month. We'll be hitting a lot of new locations. Check our websites out. We'll have those links available to you. Hey, thanks for tuning in with us again. And we hope to see you follow up with us with some corrective exercises a little bit later on a new video. Thanks a lot.
Thanks.